Hey everyone, welcome back to the channel. Today's video is about something big, and honestly, a little uncomfortable in a good way. AI officially stepping into healthcare in a serious, production-ready form. Not experiments, not demos, real tools, real medical data, real systems, and real responsibility. And at the center of it all are two familiar rivals, Anthropic and OpenAI. Over the last few days, both companies made moves that signal the same thing. Healthcare isn't just a future use case for AI anymore. It's happening now, and it's happening fast. Anthropic kicked things off by announcing a brand new suite of healthcare and life sciences features for Claude. These tools allow users, clinicians, and healthcare providers to work directly with medical data, including personal health records, in a way that mirrors what OpenAI just launched with ChatGPT Health. The timing wasn't subtle. Anthropic's announcement landed just days after OpenAI rolled out its own healthcare experience, making it clear this isn't coincidence, it's competition. The core idea is simple, but powerful. Claude users can now securely connect their medical records, fitness data, and health information, and use AI to actually understand what's inside those documents. Lab reports, insurance details, coverage rules, treatment notes, the kind of stuff most people struggle to interpret without a medical background. Anthropic says this is about helping people navigate healthcare systems that are complex, fragmented, and often overwhelming. Eric Abrams, Anthropic's head of life sciences, described it as solving a very human problem. He said that when people deal with healthcare systems, they often feel alone, constantly juggling data from different sources, making phone calls, and trying to stitch everything together themselves. His vision is a world where Claude handles that orchestration, pulling together medical records, insurance details, and personal context into one coherent experience. And Anthropic isn't pitching this as just a consumer tool. Claude for Healthcare is built to operate inside real medical environments. The company says the platform now includes HIPAA-ready infrastructure, meaning it's designed to handle protected health information under U.S. healthcare privacy laws. Claude can connect to federal healthcare coverage databases, the National Provider Identifier Registry, ICD-10 codes, CMS coverage rules, and PubMed for medical research. These integrations let clinicians look up policies, validate coverage, and scan research without bouncing between systems. There's also a strong focus on reducing administrative burden. Anthropic says Claude can help automate time-consuming tasks like preparing prior authorization requests, supporting insurance appeals by matching clinical guidelines to patient records, and assisting with healthcare billing and provider verification. Dhruv Parthasarathi, CTO of Commure, which builds AI tools for medical documentation, said these features could save clinicians millions of hours every year and give them more time with patients. For individual users, Claude now supports connecting personal health data from services like HealthX and Function Health, with Apple Health and Android Health Connect rolling out in beta for Pro and Max users in the US. This week, Anthropic emphasized privacy heavily, saying health data shared with Claude is excluded from model memory, not used for training future systems, and that users can disconnect or edit permissions at any time. At the same time, Anthropic has been careful to draw boundaries. Their acceptable use policy requires that a qualified professional review any content used for healthcare decisions, diagnoses, patient care, therapy, or mental health guidance. Abrams was clear about that. These tools can save 90% of the time spent on certain tasks, but for critical use cases where every detail matters, humans stay in the loop. Now, while Anthropic was rolling this out, OpenAI was already making waves of its own. Last week, OpenAI unveiled ChatGPT Health, a dedicated health experience inside ChatGPT. The company revealed that hundreds of millions of people already ask wellness and health-related questions on ChatGPT every week, which made healthcare a natural next step. ChatGPT Health lets users connect personal medical records and wellness apps like Apple Health and MyFitnessPal, and then ask questions to better understand patterns over time, not just moments of illness. OpenAI has been very explicit that ChatGPT Health is not intended for diagnosis or treatment. Instead, it's positioned as a navigation tool, helping users make sense of their health data, ask better questions, and prepare for conversations with professionals. Access is currently rolling out via a waitlist. Alongside that, OpenAI also launched OpenAI for Healthcare, a separate suite aimed directly at clinicians, healthcare administrators, and medical researchers. This split is one of the biggest differences between the two companies. OpenAI is separating consumer-facing healthcare tools from enterprise and clinical tools, while Anthropic is blending consumer and industry capabilities into a single platform. OpenAI for Healthcare focuses on things like documentation, clinical reasoning, prior authorization, evidence synthesis, and day-to-day operational workflows. Early pilot customers include Cedars-Sinai, HCA Healthcare, Baylor Scott and White Health, and Boston Children's Hospital. Anthropic, on the other hand, already counts healthcare organizations like Banner Health, Sanofi, Novo Nordisk, Heidi Health, Elation Health, and Viz.ai among its customers. Pro and Max Claude users can already connect and query their medical records today. Both companies say personal health data is isolated, protected, and excluded from model training. Both stress privacy, access control, and user consent, and both are stepping into a space that's under intense scrutiny. That scrutiny isn't theoretical. The rollout of these tools comes after months of growing concern about AI chatbots dispensing mental health and medical advice. Just recently, Character.ai and Google agreed to settle a lawsuit alleging their AI tools contributed to worsening mental health outcomes among teenagers who died by suicide. That context hangs over every healthcare AI announcement now. Anthropic and OpenAI both acknowledge that their systems can make mistakes and are not substitutes for professional judgment, but at the same time, they're arguing that for billions of people who lack access to essential medical care, AI can help summarize, synthesize, and explain information that would otherwise remain inaccessible. And while this healthcare push was unfolding, another major OpenAI shift was happening quietly in the background. Anthropic and OpenAI aren't just racing to build smarter models, they're racing to embed AI into the most sensitive, personal, and high-stakes parts of human life: healthcare, voice, personal data, daily decision-making. Anthropic's valuation is now rumored to be around $350 billion, and OpenAI continues to push aggressively across consumer and enterprise products. Both companies are signaling that the future of AI isn't just about answering questions on a screen, it's about orchestration, autonomy, and trust. And that's what makes this moment so important. These tools can save time, reduce burnout, and expand access to care, but they also raise serious questions about safety, accountability, and governance. Both companies say humans stay in the loop. Both say AI amplifies experts, not replaces them. The real test will be how these systems behave once they're deeply embedded in real-world healthcare workflows. That's where things stand right now. AI isn't knocking on healthcare's door anymore. It's already inside, quietly getting to work. Thanks for watching. This is AI Tides, and I'll see you in the next one.